this is Ms. Roberts. I'm covering Chapter 25, Caring for the Child with a Cognitive or Psychosocial Impairment. This is a hard chapter, talking about anxiety disorders and abuse, and so just be prepared when we're going through this. Anxiety in kids is a lot more common than it used to be. I think social media has a prevalence in that. Significant stress to be like other people, and to, quote, keep up with the Joneses or whatever, as far as teenagers are concerned. On page 849, it starts talking about mental illness in children, the anxiety, the diagnosis here, it's different signs and symptoms of panic disorders. We talked about social anxiety, generalized anxiety, PTSD occurs in some children, just if they've had a hard past. There's a video I'm going to show you in class. On 851, it starts talking about different mood disorders, and this is PTSD on 850. There's different books and resources for kids and their parents coping with anxiety. Mood disorders, though, so major depression, dysthymic disorder, and bipolar disorder, okay, where they swing from depression to a manic episodes, okay. Make sure you read through those. Let's look at page 852, bipolar disorder, and what that is, and then suicide, okay. Very, very sad. It's the second leading cause of death between 10 and 24-year-olds. Yes, 10-year-olds and 24-year-olds. Second leading cause of death. So Winks and Lollipops here. I have a note in my book that you need to write down. Let's look at this right here, though. Let's see. Right here. So all of this is Winks and Lollipops, okay? So the most common methods of suicide are firearms, 46%, suffocation, 37%, and poisoning, which is 8%, okay? Even though you cannot link owning a firearm to the increased risk of suicide, okay? So we live in South Georgia, a lot of hunters here, right? But you can't associate, just because the parents have a gun in the house, means that the child's more likely to be able to commit suicide or commit suicide. That's not the case. Most parents that own firearms that are avid hunters or whatever, they're educating their children, okay? It's the ones that don't educate their kids, you know, that have the problems. You need to be educating your parents to educate their children about gun safety, okay? But you still need to be asking the question, you know, this is what you need to write down. So for at-risk suicide child, so if they've threatened suicide before, the nurse needs to be asking the parents, do you have firearms? Do you have guns in your home? Are they locked up? Do they have a lock on the actual gun? And you can get these anywhere. Sheriff's departments give these away. Police departments give the gun safety locks away, where they can lock it up, where the gun cannot be fired without a key to go in that lock to unlock it for use, okay? It's very, very important to educate those kids on the gun safety, okay? goes through different common symptoms of bipolar disorder. They go from really, really happy, lots of talking, hypersexuality. They're, discard, they don't care if it's a risk for safety. The impulse behaviors, spending sprees is huge, okay? And then that goes to depression. Sad, irritable, change in sleeping and eating habits, recurrent thoughts of death and suicide, worthlessness feelings. And then on 854 it talks about schizophrenia, okay? And it's a serious chronic disorder, can occur early. It's to deal with the abnormal neurodevelopment in the child, okay? Here's some signs: hallucinations, delusions, so make sure you read through that. Reactive attachment disorders, rare, emotional attachment with others, like they can't function without being around a specific person or item or anything, so make sure you read through that. And then of course our big one, ADHD, right? Attention deficit hyperactivity disorder. We see this a lot. Unfortunately it's used as a crutch because now parents can get a disability check for their children that have ADHD, and it's abused. Some children or providers are actually, I feel like they're forced to diagnose this from the parents, just where they can get that money, and it's very sad because the child suffers from that. Not everybody needs a pill, okay? Behavioral therapy is a huge, huge benefit for this, okay? It's increased 22% over the recent years. So, I believe that if somebody needs the medicine, of course they need it. My son took it when he was younger. He only took it when he was in school. He didn't take it on the weekends. He didn't take it during the summer. It was not a Band-Aid. It was not a babysitter, okay? He took it for about 2 years in elementary school, and then I stopped him during middle school, and he actually requested it back when he was in, I think, the 8th grade. He wanted to start taking it because he felt like he functioned better in school, and he did. He was a C student in the 7th grade and a straight A student in 8th, 9th grade. So it made a big difference, and he recognized that himself, and I let him make that decision. Is that for all children? No, it's not, but parents need to give their children the option, and he's grown out of it. You can grow out of it. Some adults are diagnosed with ADD or ADHD as they're adults, so it can be diagnosed later on in years, okay? All right. On 857, we're going to start talking about the maltreatment of children. This includes abuse and neglect of anyone less than 18 years of age. There's different types, and you probably recognize who this is. It's the movie The Act, and all the things that go with that. If you have not seen that, it demonstrates the Munchausen by proxy, okay? And this is a mother, usually the mother, 99% of the time it's the mother, that often makes the child sick or elicits symptoms of being sick just for attention. And that's what happened to Gypsy Rose in this right here. Her mother told her she was allergic to sugar, just all kinds of things that made, like, she couldn't walk, pulled her teeth out, when really and truly nothing was wrong with her. This was a true story. Gypsy Rose had somebody kill her mother. She went to prison. I think he's still in prison. But I'm sure you've all heard that all over media about Gypsy Rose. So, statistically, this happens. Maltreatment of children happen to children that are living in poverty. They are more, this is Winks and Lollipops, they are more prevalent to deal with abuse and neglect. I think it has to do with the parents being stressed out, their anger, they take it out on the kids instead of dealing with it themselves. And that's on 857. 858 talks about the signs and symptoms, what to look for, types of abuse, physical, sexual, emotional, and then neglect. So make sure you understand these and the difference, okay? Some Winks and Lollipops. If you see some suspicious bruising, healing or healed lacerations or abrasions, you need to be asking the parents what caused these bruises, okay? 2 parents are there, get them in separate rooms and ask them separately. See if they have the same story. And then talk to the child, okay? But you need to know what's causing these. Shaken baby syndrome is another one, okay? Burning, biting. I remember being in the 1st grade and the little girl that I went to school with came to school with the shape of a clothing iron that you iron clothes with burned into her cheek. And she lived with her grandmother because her parents had been abusive. Very, very sad situation. But she had a scar in the shape of an iron where they had put an iron on her face. Page 859. Clinical judgment alert. Reporting cases, okay? 1-800-4-CHILD. You need to memorize this number, okay? Report any suspicious activity that you see, okay? Very, very important. And then another thing you need to write down, it's written down in my book, you need to reinforce to the child, it is not your fault this happened. It is not your fault this happened. If you've ever seen the movie Good Will Hunting with Matt Damon, it's an older movie, very, very good movie, but and Robin Williams is in it too, but it talks about he was a genius, actually a genius, but was abused as a child. Very realistic thing that could happen, and I just remember that he kept telling him, it's not your fault, it's not your fault, it's not your fault. It's important for them to understand that. We'll watch this video in class. It's very heart-wrenching, and about an abuse case of a baby. So, all right. Let's see. 861 starts talking about anorexia nervosa, some bulimia stuff. Let's get there. And so there's different, a cage tool and a craft tool that you can do to assess for alcohol, eating disorders, alcohol abuse in children. Anorexia, an eating disorder, make sure you read through that. Know that their labs are going to be off, okay? They're going to be off. They're going to be hypokalemic, hyponatremic, leukopenia is even there, elevated bilirubin, and then some education, okay? Some more Winks and Lollipops here. Make sure you understand that you need to be doing a team approach, okay? Work with social workers, work with psychiatrists, work with dietitians, all of these things. Team approach is best, okay? Multidisciplinary is what I have in my book. Multidisciplinary teams, okay? All right, and then on page 863 is this top 10 healthy sleeping habits for children. Make sure you read through that. Take that cell phone away. Teach those parents. When my kids were younger, they had to charge their phone in the kitchen, and it was put up. They were in the bed at 9 o'clock. They had to charge their cell phone in the kitchen. They could not have it at night where they could get on it and stay up all night long. Maybe I need to keep doing that for my about to be 16-year-old. Case study, sleeping issues. Okay, make sure you read through that case study. Page 864 is talking about developmental disabilities. Fragile X is mentioned. Down syndrome is mentioned. Make sure you read through that and understand the signs and symptoms of that, okay? And then 866 is discussing autism, okay? Autism spectrum disorders, you know, we know it now as on the spectrum, ASD. So read through that. I want you to understand the signs and symptoms of autism. Some of them can be highly, highly intelligent. Asperger's is one of those. So read through that. Just kind of research. It's very interesting to know the difference. And then understanding it here. Alarm. Autism is prevalent. Listen to the patients. Act early, refer, and monitor. Okay? And that is it for chapter 25.